background of study. Drug abuse refers to the harmful or excessive use of the substance, whether it is legal or illegal, that can affect a person's mental and physical health. University students are particularly vulnerable due to a combination of newfound independence, stress, and peer pressure. In University of Malaysia Kelantan, increasing concerns has been raised regarding this issue, especially because of its rural settings, which also might lead to underreporting and less visible cases. This backdrop sets the urgency and importance of our research. And for the next slide, which is slide 4, titled Psychological and Social Factors. There are multiple reasons why students may turn to drugs, including, like I said before, peer influence, emotional stress, and also low self-esteem. Some students may use illegal or legal substance to help them focus, relieve anxiety, or just to simply fit in social, which is among friends, under their influence, of course. But according to social learning theory, behavior like drugs, drug use are often learned by observing the others, meaning students may normalize this behavior if they see it, this behavior in their peers. Media and online platform also plays a role, often portraying drug use in a casual or even appealing light, which further reduce the perceptions of danger. Next is slide 5, the problem statement. Despite various anti-drug efforts by the government and universities, drug misuse continues to rise, especially among those aged 19 to 35 years old, which include most university students. At University of Malaysia Kelantan, there is a growing concern, but no reliable data or research exists to help us understand the scale of the problem. So students often avoid in confessing or reporting drug use due to fear of the punishment or stigma, making the issues even more merely impossible to detect and address. The study aims to uncover the underlying causes such as academic stress, peer group pressure, or easy access to substance, to guide the future intervention efforts. For the next slide, which is slide 6, research objective. The study is guided by two primary objectives that aim to shed light on the issues of drug abuse among students at University of Malaysia Kelantan. Which is the first one, we seek to acknowledge the prevalence and demographic patterns of drug abuse among UMK students. This includes identifying which age groups, genders, faculties, or year levels may be more affected, helping us to understand who is most at risk. The second is we aim to explore and identify the key causes behind drug abuse in the student population. Factors such as peer pressures, academic and emotional stress, and easy access to substance will be examined closely. Based on these findings, we also aim to recommend practical and effective intervention strategies that can be implemented by this university or support organization to prevent and reduce drug misuse on campus. For slide 7, research questions. In order to achieve our research objective, this study is centered around two key questions that guide our investigations. First, we ask, What are the main factors contributing to the rise in drug abuse among UMK students? In exploring this, we aim to uncover how social pressures such as peers influence academic challenge like exam stress and heavy workload, as well as environmental factors, including access to drugs and lack of awareness, may influence students' choices and behaviors. Second question is we explore how effective are UMK's current policies and support system in preventing or addressing student drug abuse. This involves evaluating the existing preventive measures such as awareness programs, counseling service, and disciplinary actions to understanding whether they are sufficient and accessible and what improvement may be needed to better support students at risk. For slide 8, which is significance of study. The study holds significant value for multiple reasons, both academically and socially. Firstly, it contributes to the existing body of academic knowledge, particularly within the context of Malaysian higher education. Currently, there is a lack of detailed data and analysis on drugs abuse among university students, especially at institutions like University Malaysia Kelantan. By addressing this gap, our study provides a foundation for future research and policy discussions. Secondly, the findings from this research can directly assist University Malaysia Kelantan officials, counselors, and students affairs departments in crafting more targeted and evidence-based intervention programs. Beyond the university's government agency, such as ATK, Agency Anti-Dadah Kebangsaan, can also benefit from this data to enhance national level strategies and outreach efforts. In addition, this study serves as a valuable resource for parents, teachers, and support groups. It helps them better understand the behavioral and emotional signs that may indicate a student is at risk, allowing for earlier intervention and more meaningful support. Next is slide 9, scope of the study. This research is specifically focused on undergraduate students enrolled at University Malaysia Kelantan, UMK, covering all three main campuses, Bachok, Jeli, and Bekalan Cepa. By including students from diverse academic backgrounds and geographic location, we aim to provide a more comprehensive understanding of the issues across the entire university community. Our study examines several key aspects related to drug abuse. These include the type of drugs being used, the prevalence and the frequency of use, the underlying causes such as emotional stress, peers' influence, and environmental access, and students' attitudes and perception toward drugs consumption and related risk. It is important to note that the study will exclude alcohol and tobacco use unless these substances are found to be directly associated with our lead to illegal drug abuse. Our focus remains on substances classified as illicit or harmful under Malaysian law and university regulation. Additionally, we assess the effectiveness of UMK existing drug prevention and awareness programs with special attention to change the development made in the last 3 to 5 years, particularly in response to the COVID-19 pandemic, which may have altered student behavior, stress level, and support system. By narrowing our scope in this way, we aim to provide focused, relevant insight while still capturing the broader context and impact of drug-related issues among UMK students. For slide 10, definition of key concepts. In order to maintain clarity and consistency throughout the study, we have clearly defined several key terms that are central to our research. First is drug abuse. This refers to the harmful, excessive, or improper use of substances, whether they are legal or illegal, that negatively impact an individual's physical, mental, or social well-being. include both occasional misuse and habitual dependency. Next is illegal drugs. These are substances that are prohibited under Malaysian law, such as shabu, ecstasy, cannabis, and other narcotics. The possession, use, or distribution of these substances is a criminal offense and falls under strict national enforcement. Next is UMK students. For the purpose of the study, this term specifically refers to undergraduate students enrolled in any programs or faculty across UMK's three campuses, which is Bachok, Dili, and Pangkalan Chepah. Next is growth. This concept represents both the increase in the numbers of drugs abuse cases reported among UMK students and the rising awareness of visibility of the issues within students' population and university community. Next is contributing factors. These are the internal and external influences that lead students towards drug use. They may include peer pressures, academics and emotional stress, family problems, financial struggles, and the accessibility of availability of drugs in certain environment. Next is attitude and awareness. This refers to what students know, believe, and feel about drug use, how informed they are about its risk, the level of concern, and the willingness to seek help or support others facing substance abuse. By clearly defining these terms, we aim to avoid ambiguity and ensure a shared understanding among readers, researchers, and stakeholders involved in interpreting the finding.
Based on our literature review, we found several recurring patterns and causes of drug use among university students, particularly those relevant to UMK. The most influential factor is peer pressure. Students are likely to use drugs when they see friends doing the same and often avoid social isolation. Academic and emotional stress is also triggered with many students resorting to drugs to manage anxiety or perform better during exams. Another rising concern is the role of social media. Students can easily access drugs or get exposed to drugs content through online platforms, making it more accessible and normalized. While UMK and other universities have taken steps through rules and awareness programs, most current policies fail to address root causes like mental health and peer influence. Our study uses Bandura's social learning theory, 1977. This theory explains that people learn behaviors by observing others, especially peers or role models. In the UMK context, if a student sees friends using drugs without immediate negative consequences, they may assume it's acceptable behavior. This often reinforced when drugs seem to help students cope with stress or blend into social groups. Therefore, prevention efforts should not just focus on punishing behavior, but also changing what students observe and believe, like promoting positive peer role models and real consequences of drug use. Based on our theoretical foundation, we developed four hypotheses, which is Hypothesis 1, students with drug-using friends are more likely to use drugs. Hypothesis number 2, higher academic stress leads students to use drugs, especially before exams. Hypothesis 3, students with a positive attitude towards drugs tend to use them more frequently. Hypothesis 4, regular exposure to drug content online increases the likelihood of involvement in drug-related activities. These hypotheses guide our data collection and analysis to test whether these factors are statistically and meaningfully linked to drug use at UMK. This study uses a mixed methods approach, combining both quantitative and qualitative research. The quantitative part involves a structured questionnaire distributed to 200 to 300 UMK students across campuses. The qualitative part includes in-depth interviews with 8 to 10 individuals, including peer mentors, counselors, and students with first-hand experience. Together, this combination helps us to understand both the broad trends and the personal stories behind them. We apply both descriptive and inferential statistics for quantitative data. We'll use tests like chi-square and ANOVA to find correlations between variables. For example, the link between stress levels and drug use. For qualitative data, we use thematic analysis, identifying patterns like peer pressure, stress, or lack of support from interview responses. Finally, we integrate both datasets to provide a comprehensive picture of drug use trends, causes, and perceptions at UMK. To ensure our findings are credible, we focus on validity and reliability. We conducted a pilot test with 20 students to refine a questionnaire. For reliability, we will use Cronbach's alpha, and a score above 0.7 confirms consistency. For interviews, all sessions are recorded, transcribed, and peer-reviewed. We also maintain strict ethical standards, confidentiality, voluntarity, participation, and anonymity. This study offers several valuable contributions. First, it gives UMK administrators real data to design effective targeted intervention programs. Second, it supports students, counselors, and peer mentors by highlighting the key factors students face. Third, it informs national agencies like AADK, allowing them to tailor strategies for rule-based universities. And finally, it empowers students themselves, raising awareness, reducing stigma, and promoting a more supportive campus culture. This study offers several valuable contributions. First, it gives UMK administrators real data to design effective targeted intervention programs. Second, it supports students, counselors, and peer mentors by highlighting the key factors students face. Third, it informs national agencies like AADK, allowing them to tailor strategies for rule-based universities. And finally, it empowers students themselves, raising awareness, reducing stigma, and promoting a more supportive campus culture. To conclude, drug abuse among UMK students is a serious and growing issue. Through this research, we aim to fill all critical data gaps, identify root causes, and recommend realistic and effective solutions. Our findings will hopefully guide UMK and other stakeholders in building a safer, healthier, and more resilient student community.